Welcome to another Renew Education case study. This case study is a follow-up to the lower, if you haven't seen the lower, or you can follow the upper and now watch the lower. So this upper one we're going to call Future Unknown. And the reason why I kind of bring up Future Unknown in this particular one is because she does have teeth that have root canals in it, and a lot of the failures just over time, because you have a more brittle tooth when you have a devitalized tooth structure, that you eventually will lose those. And the reason why it's Future Unknown is because down here, if you watch the lower one, we can put two implants in the place towards a future known. If she loses her teeth, we know that those implants are in the right spot. Whereas to restore here, this is kind of like, where do we see ourselves in the future if this person goes into a full arch restoration? So here we have root canal, compromised teeth here. This maybe is just a filling there, but that's not too bad. Not worried about that, not too worried about that right now. So this one would need a crown for sure. That's our primary chewing area on number 4. But I really think that this one could be solved pretty simply, but in a future where we're not really sure where she's going to go with the dentistry, because this is looking like we're spending a lot on tooth by tooth type dentistry, not kind of a full arch rehabilitation in a full arch piece where we're looking at a denture piece, an overbar denture, locator hybrids, whatever you're going to do. So let's look at our treatment assessment. Our treatment assessment basically says that our sinus is the orange up here in the upper right side, but the rest look pretty good. There's a yellow ridge height, maybe yellow detached gingiva, but really everything else, bone quality, density, that kind of stuff, all that stuff is pretty much looking at greens or light greens. So her health history, everything else is good too. So let's jump in. Let's look a little closer at this case here. And we look at the number 3 area, and here's our problem. That's a recent extraction, so it's still kind of filling in with bone, but we don't have a lot of ridge height here. And you're definitely going to be doing a crestal approach. Sinus lift, let's see how much room we've got. You've got about 9 millimeters. So that's fine. Anytime I only go into the sinus 2 millimeters or less, I don't add graft. So I take my sinus tools, I do a crestal approach, and typically I'll do a compressive technique, and I'll put the implant in and only push the floor of the sinus up, 2 millimeters or less. And that works out great. They usually get bilateral, what we call bilateral, bicrestal security with that particular area where the implant is secured up here as well as right here. The tooth becomes a little bit top heavy to the implant. So let's see, that tooth would be kind of more right here. Maybe we would be, actually the implant would be closer to there. So you're at about 12, 13 millimeters before you get to maybe occlusion with the opposing from the top of the bone height, and the implant size would be probably a 10. So you're a little bit top heavy, that would be a 10. So not a deal breaker at all. It's just, this would be a very successful case. You want to do the crown here, of course. And then they're pretty much fully restored. Comes down to what I call use and abuse, so that patient understands like how much to chew on particular teeth, or maybe try to cut back on all those hard nuts that people like to chew on. So let's look at the upper left side, and now that upper left side here shows us a possibility here, possibly. Now we have a premolar, or a canine here that's lost. Here's what the bone looks like here. Bone looks pretty nice. If we go forward, it's going back, let's see, we'll go a little bit more forward in the anterior position. Here's where our teeth actually are, so that's not too bad. It's not far off the shape, meaning this angulation of what we need our canine to do is not too far off where we would expect to have the bone trajectory. So that's not a bad position. So let's see if we can put an implant in there. If we put it's probably going to be a 3.5 case here. So let's look at that. And here's a 3.7 by 10. Let's say 3.7 by 11. And we'll put that in. So that's perfect. So that's not a bad scenario for a single tooth implant for that case. Now, one of the question marks is here. Let's see. I think we moved ourselves out of the arch too much. Okay, let's see. Let me refix that arch form. All right, much better. Now, the patient can decide on, they could do a 3-unit bridge here. We have canine to premolar. We should have a pretty good, nice size implants. That looks like a 4.2 or something. And then you have this implant. So you could do one implant here, no sinus graft necessary, just let that bone heal. And now you have an implant here, an implant here. Now, the future here is, what if the patient goes into a full arch situation in 5 to 10 years, they get recurrent decay, they have dry mouth or something like that. And that can be a real scenario for patients. She's still in her low 60s, mid 60s, and so that, going into 75, if she's on more heart meds or anything like that, you can get more decay, or these root canal treated teeth are only going to last so long. She's going to come down to our 50-50 rule. So we already have an implant here, we have an implant here, we have an implant here, we have an implant here. So she's going to get really great stability coming through here. So she may only need one implant over here to get into a full upper arch solution down the road. So the question is, does this implant here make sense? So right here, yes, we have good bone. Yes, you can put an implant in there. Yes, you will be successful. But with all the things that this patient's needing, do we need to do that when her future is more on looking at what her tooth by tooth general dentistry that's been done already needs maintenance and care? I just feel that from a doctor situation where we're looking at the best for the patient, my feeling is I would put a bridge in this solution here. I'd put a single implant here and start positioning the implants for the next 15, 20 years so that we can, utilize her financial situation in probably the most productive way possible. Now, you might argue that. That's fine. Please leave comments on our channel or under the video, whatever you like to do. That's cool. Love to do that. We will be doing more and more case studies live, actually. So check us out on Facebook and YouTube for sure. We're going to do 2 live broadcastings on different times for those, as well as look at our YouTube channel where we hold all our stuff. And please subscribe and like us to both of those. Thanks a lot. Take care.